Hi, my name is Chaina Adhikari. I'm a DNP student. Today I'm going to present my evidence-based practice science project. The PICO question is, in patients with dementia in long-term care facilities, does non-pharmacological intervention reduce behavioral symptoms of dementia over the period of 6 months? Problem statement. Dementia has become a major health problem in elderly populations, resulting memory impairment, behavior disorder, functional impairment, and decrease in cognitive abilities, such as thinking, judgment, and processing of information. More than 90% of the persons with dementia develop at least one neuropsychiatric symptoms of dementia, such as anxiety, agitation, depression, or irritability. Dementia has become the sixth leading cause of death in the United States. Dementia is one of the main reasons patients are admitted in long-term care facilities. As dementia progresses, patients develop multiple behavioral problems. As a result, they use multiple medications and require frequent hospitalization. Psychotropic medications increase the risk for high fall risk, fracture, head injury, intracranial hemorrhage, disability, and death. A pharmacological approach may also worsen the symptoms and have adverse side effects. Therefore, it is essential to explore non-pharmacological intervention in dementia management. Evidence. Based on the evidence, a non-pharmacological approach should be the first option to manage behavioral symptoms of patients with dementia. The American Geriatric Society and the American Association for Geriatric Psychiatry currently considers non-pharmacological approach to be the first-line intervention. Non-pharmacological interventions such as music therapy, art therapy, behavioral therapy, and physical exercises are the mainstay of managing dementia-related behaviors. Non-pharmacological approaches have fewer side effects and can be considered the safe option. In my clinical setting, I have often encountered staff frustration and demands for medicine to manage the patient's behavior. I have observed a gap between the evidence guidelines and the clinical practice area. CMS requires the avoidance of unnecessary use of psychotropic medications. Nursing home quality measures are also affected by the overuse of psychotropic medications. Many studies from different countries have shown that psychotropic drugs should not be prescribed to dementia patients because of its increased risk of seizure and increased mortality. Therefore, providers and staff should consider non-pharmacological interventions program as the first option intervention to treat behavioral and psychological symptoms of patients with dementia. Method. For my EPP project, I plan to conduct a retrospective chart review to assess the use of psychotropic medication in patients with dementia. The plan is to review approximately 200 to 300 charts from three different long-term care facilities. First, I will get an IRB approval for the study. I will also need to get a permission from stakeholder of the organization. After then, I will review the charts of the patients who have been getting psychotropic medication for the past 6 months. Inclusion criteria will be ages 60 years and older who have behavioral symptoms. I will only include patients from the long-term care facility. Exclusion criteria will be patients who have stayed at the nursing home for less than 30 days, or SNF patients. I will collect demographic data including name, age, gender, race, and education level of the patient. Based on the current practice guidelines, the following data will be measured. Number 1. Is there any documentation of utilizing non-pharmacological intervention as the first line of treatment for managing dementia behavior? Number 2. What non-pharmacological interventions were used to manage these behaviors? The choices include cognitive behavior therapy, music therapy, art therapy, physical exercises, and others. Number 3. Which psychotropic medicines were used? The choices include antidepressant, anti-anxiety agent, and psychotropics medicine. Number 4. Did the residents' behavior symptoms get under control with the intervention? Then the data will be analyzed using spreadsheet tables and descriptive statistics. The finding of the study will be helpful in developing a training model for providers and staff to fill in the gaps between current practice guidelines and the clinical practice in relation to dementia care. I believe that my EBP project will be applicable in the nursing home and may potentially help reduce the burden of the family and caregiver as well as improve the quality of life in elderly with dementia. Thank you for listening my presentation.